let's first start with gentle squats. So with her, you'll notice it's important she's not going past that 70-degree limit for her total hip precaution. So 2 sets of 10. Gentle hamstring stretch. I'll have you come down into the deeper water. You can either do it there or in the deeper water, whichever you're most comfortable.
Both legs?
Yep. Only if you tolerate it well. There you go. Not past 90. Come down in between the treadmill or onto the treadmill.
I don't like to do.
I'm going to let you do I'm going to have you do gentle hip work, and I want you to alternate. So first,
side?
So turn and face that way and alternate one hip out and then the other hip out. You can do it that way or you can do it this way inside the treadmill, whichever's. Okay. Turn and face forward now and straight back.
I'm tired of going backwards. Can I go frontwards?
Yep, you can go frontwards now.
Thank you.
Put yourself in the bum. You feel okay with that?
Yeah.
I'm going to go heel toe.
On you, see. This is new. This is a new one for me.
Last one. And you're exactly right. I want you to do it on both. And eventually you'll do it without holding on. And the important thing, Ann, is to make sure that as you're doing it, you don't allow this to happen. So you're strengthening, you're doing good motion with your right, but you're strengthening your stabilizers in your left by having to hold the stance on that. So one of the things that you see from weakness after a hip is they'll walk, and when you put weight through that hip, they'll tend to drop because you get weak glute medius. So just doing the single leg stance while you do your right foot will help that. And then after you're done with your right, I'll have you do your left. Okay, I'm going to let you walk now.
Okay.
And so what I do want you to watch is, actually it's better now that you started to warm up. So when it goes back to the side view, I want you to watch something for me. Let's wait, because it looks pretty good in front. Okay, watch how short your step length is on your right. Do you see how you stop?
It's beginning to hurt.
It's beginning to hurt in your left or in your right?
My left.
Okay, so let's go back a little slower. What I want you to do is
Lengthen my left.
lengthen. So the reason you are not stepping past with your right is because you're not letting your left have the weight as long. Because what happens is you don't want the weight through your left so long, so you make it short. Whereas if you step long through the left, you step past. Step farther forward, longer on that left. Yeah. Because what research supports is to maintain the health of a joint, you want to do high repetition, low resistance exercises. So that means things like the total gym at a very low level. So you're not getting impact, you're getting a high number of motions without anything that's driving the fluid out of the joint. Deep water aerobics, walking in the water, doing aquatic exercises, it's wonderful. Now you still want to incorporate some impact, some land activities so that you still maintain good bone density. Like walking. And actually walking in the pool is one of the greatest pain relievers for them, because that high repetition, low resistance decreases the inflammation in that hip joint and increases their pain control. And they will often feel better for hours after being in the pool. So, and I've had patients that specifically come here as often as they can so that they can decrease their pain medications after hip surgery.